A 71-year-old male presented to our department with a 6-month history of progressive myelopathy and complained of persistent abdominal pain. MRI of the thoracic cord performed elsewhere demonstrated cord edema from T5 to T8 or T9 with prominent adjacent vessels, likely in the subarachnoid space. CT report stated that dural fistula is fed likely on the left from T6 to T7. With a spinal dural fistula suspected, the patient was referred to us for the angiogram. Describe the suitable angiography procedure to the patient. Spinal dural fistula is an abnormal connection between an artery and a vein that are located near the covering of the spinal cord, which called dura. Although MRI and CT are the common modality used to diagnose spinal dural fistula, they do not show where exactly the fistula is, only that one is likely present. Therefore, to better demonstrate the feeding vessels, the next step in evaluation of the fistula is the spinal digital subtraction angiography. A spinal DSA is minimally invasive and time-consuming procedure that offers an extremely precise evaluation of the blood vessels surrounding the spinal cord under fluoroscopic guidance.
Hi Mr. Lee, I am Farah, an angiographer here. You are giving an appointment for the spinal digital subtraction angiography procedure, right?
Hi Farah. Yes. I was recommended for the spinal DSA procedure.
Okay. Now, I will be asking a few questions related to this procedure and will then explain to you the necessary preparation before the procedure.
Sure.
First, do you have any cardiovascular problem or taking any medications? As you might need to stop the anticoagulant medicine before the procedure according to physician's advice.
Yes, doctor asked me to stop taking the medicine one day before the procedure.
Alright. Do you have any history of kidney diseases or any other health conditions such as diabetes? If you have diabetes, you are required to stop taking metformin 2 days before and after the procedure.
I do not have diabetes and any history of kidney diseases.
For this procedure, we will be using contrast medium to get a better look of the structure. So, before the scan, you will need to do a blood test that check on your kidney function and blood clotting to ensure that the procedure is safe to be carried out without risk of kidney damage or excessive bleeding.
Noted.
So, I would like to know whether you have allergy to any medications or seafood, or do you have asthma? If yes, our physician will prescribe a medicine called prednisolone to reduce the risk of allergic reaction.
I do not have allergy and asthma.
As informed by doctor, you will be given general anesthesia to reduce involuntary movement due to pain during the procedure so that we can get a better quality of images. So, you are required to fast for 12 hours before the procedure to reduce the risk of aspiration. Are you clear with that?
Yes, I am clear with that.
Fasting can also reduce bowel gas shadowing. In addition, doctor may also prescribe you with some oral or rectal agents for bowel preparation to reduce the artifacts. So, please take the medicine if being prescribed.
All right.
Before the procedure, a nurse may place urinary catheter as this procedure might take few hours to complete. A needle called intravenous cannula will also be placed on your arm first. Also, 1 day before the procedure, you are required to admit to the ward as we will need to monitor your vital signs such as cardiac and oxygen saturation to ensure that you are safe and ready for the procedure, okay?
Noted.
Do you have anything else that you want to know, Mr. Lee?
May I ask again what is the possible complications of this procedure?
Some patients can have an unusual allergic reaction to the contrast. There is a very tiny risk that blood will form a clot around the tip of the catheter, blocking the artery and causing a stroke. Very rarely, the catheter can cause dissection of a vessel which can potentially lead to cord ischemia. Delayed bleeding at the site of catheter insertion is very uncommon, but it is the major reason that you are observed for 4 to 6 hours after your test is completed.
Oh. Okay.
Also, may I know whether you have signed the consent form from Dr. Mr. Lee?
Yes. I have signed the consent form. Would you mind to explain to me on how will the entire procedure be carried out?
Sure, Mr. Lee. The procedure will be performed in a room specifically designed for angiography of the nervous system, the neuroangiography suite. This room is equipped with fluoroscopy machines that use X-rays to create images of blood vessels as the contrast is given through the catheter into the spinal vessels. The pictures are recorded and displayed on screens that the radiologist watch as they are performing the procedure. The doctor will look at the picture more closely after the procedure. Since you will be admitted to hospital one day before the procedure, ward nurse will monitor your vital signs such as blood pressure and oxygen saturation in the early morning to ensure that you are ready for this procedure. Doctor will place a needle on your arm and you will then be sent to the angiography unit, wearing a hospital gown. You will be then sent to the waiting area at angiography unit. An angiography team member, which includes specialists such as radiologist and neurologist, nurses and radiographer, will take part in the procedure. On top of that, an anesthetist will also be joining the procedure to monitor your condition, since this procedure will be carried out under general anesthesia. Once in the angiography suite, radiographer and nurses will help to transfer you from the stretcher to the couch. Armrests will be put in place for your comfort. The team will make every effort to make you as comfortable as possible. As it is necessary to keep the room at a cool condition due to the equipment present, we may provide you blankets and warmer. It is necessary for you to lie flat throughout the procedure. Electrocardiogram and blood pressure monitor will be used to monitor your vital signs. Then, the anesthesia will be given by anesthetist. This minimizes movement of the patient, which degrades imaging, and allows for control of breathing and peristalsis, as the procedure usually takes longer time to complete. The area of your access site, usually the right groin, will be cleaned and shaved. The area where the catheter will be inserted will be numbed. Seldinger technique will be used for catheterization. The radiologist will first place a needle into the lumen of your femoral artery through a small skin incision. In this case, accessing the leg artery gives the radiologist a direct pathway to the vessels of the spine and spinal cord without crossing or coming close to the heart. This is then followed by a guide wire insertion that advances to the thoracic aorta, since the area of interest will be at T5 to T10 region in this case. During this procedure, radiographer will obtain fluoroscopic image that guide radiologist to advance the guide wire. Once the guide wire is at the region of interest, the needle will be removed. Once the guide wire is at the region of interest, the needle will be removed, and the radiologist will then thread the sheath over the guide wire. Then, the guide wire will be removed, and a long flexible plastic tube, specifically Cobra catheter, will be threaded over the sheath through the femoral artery to the desired location, specifically at thoracic aorta at around T5 to T10, where the fistula is more likely to occur in this case. Other catheters such as Simmons 2 or 3 and pigtail may also be used, depending on the conditions. Usually, 5 French size or 6 French size catheter will be used because of good shape retention and torqueability. Then, the radiologist will advance the catheter to individual spinal radicular arteries at T5 to T10 areas to better locate the fistula. This is followed by contrast material injection to see the spinal arteries at these regions. When injecting contrast material, a radiographer will obtain images of spinal arteries, and the image will be subtracted to better visualize the vessels. During this procedure you will not feel the catheter in the artery, but as the contrast material is injected, you may have a sense of warmth. Normally, if this procedure is undergone without general anesthesia, patient will be asked to remain still and hold their breath for a short period of time, which is around 10 seconds during each contrast injection. Sometimes, treatment such as embolization will be carried out following diagnosis if necessary. The entire procedure may take between 1 hour to several hours long. A complete spinal angiography may require bilateral vertebral angiography and selective catheterization and injection of branches of the subclavian, intercostal, lumbar, vertebral, cervical or sacral arteries. The images are typically acquired in an antero-posterior projection, but biplane angiography can be used for three-dimensional localization of pathologic vasculature. It is especially important to study both the arterial and venous phases during evaluation for a spinal dural fistula. Prolonged imaging in the venous phase of the angiogram may be necessary to diagnose fistulas with slower flow. After the angiogram is completed, the catheter is removed and the puncture site closed. The doctor will then hold pressure at that site for 15 to 20 minutes to obtain hemostasis or prevent bleeding. A band-aid will be applied. You will have to lie flat for at least 4 hours in the recovery area or ward and will be monitored by nurse. During this time, you should inform the nurse if you notice any bleeding, bruising, swelling or pain at the site where the catheter entered the skin. That's all about the spinal digital subtraction angiography procedure that you will be undergone, Mr. Lee.
Oh, so, what should I do after the procedure?
Patients usually return home about 6 to 8 hours after diagnostic spinal angiography if no complications. However, you should not drive for 24 hours after the procedure. Therefore, you should arrange your transport. On the other hand, if angiography is combined with treatment such as embolization, the time in hospital and recovery process depend on the disease being treated, At least one night in the hospital is typical.
What happened if I experience bleeding at puncture site after discharge?
If the condition occurs, you will need to go to the emergency department of nearest hospital to seek for help. Kindly drink more water to help removing contrast material from your body. If you have an unusual allergic reaction, please seek consultation from Dr. Tu.
Alright. Thank you so much, Farah.
No problem.